Hi, everyone, and welcome. My name is Amber, and I'm the lead technical specialist at PainTrace IT. I want to start by saying thank you so much for joining us today to learn more about PainTrace. What you're about to watch is a rebroadcast of a webinar we hosted with Dr. Tom Walsh. Dr. Tom Walsh is a leader in veterinary rehabilitation and a valued PainTrace user. In this session, Dr. Tom shares how he's using PainTrace in real clinical settings to better understand pain, to guide treatment decisions, and to communicate more effectively with pet owners, especially when that pain isn't obvious. We're also excited to share that this webinar is co-sponsored by Apex Veterinary Equipment and IWV Digital X-Ray, who are helping bring this technology to clinics across North America. After the webinar, we'll be back live for a Q&A session with Dr. Tom and myself. We'll answer your questions and walk through how you can learn more about PainTrace or get started in your own clinic. So with that, let's get started.
Hi, everyone, and thank you so much for joining. My name is Amber. I am the technical specialist at PainTrace IT. And for those of you who don't know, PainTrace IT is the company behind PainTrace. And the goals for today's webinar is to familiarize everyone with PainTrace. We're going to be able to talk with Dr. Tom Walsh today and discuss how he's using PainTrace at his clinic, Prime Pet Rehab. So thank you so much, Dr. Tom, for joining today. We're really excited to hear from you and see how you've been using it and get a little bit of your knowledge on how you've incorporated it into your practice. So thank you so much. And today is an interactive session. So if you have any questions or comments, please insert them into the Q&A tab in the Teams chat function. And we'll either answer them as we go or we will answer them at the end during the Q&A session. So here's an overview of what we'll go through today. So first, I will hand it over to Dr. Tom Walsh, and he will introduce himself as well as his practice. And then I will take over again, and I'll give a little bit of a background on what PainTrace is, how PainTrace works, and then a little bit on understanding and interpreting the PainTrace data. And then that'll lead into Dr. Tom's case. So he'll be able to talk about one of the cases, one of the patients he's seen in his clinic. And then he'll go through how he's using it in his practice. And then we'll finish it off with a little bit of a Q&A if we have time. So I'll hand it over to you, Dr. Tom. Thank you again
Amber,
for joining us.
For sure. Thank you so much for having me. I'm thrilled to talk with folks about PainTrace because I discovered it in my rehabilitation practice that it is really an unbelievable tool to be able to not only diagnose and treat pain, but also to monitor it and to show the progression of what your modalities are doing and how well the animal is reacting. So I'm excited to talk about it today.
Awesome. Thank you so much, Dr. Tom. We really appreciate you being here. I guess with that, I'll go into a little bit of the background on what PainTrace is. So PainTrace is a wearable device that can detect and quantify acute and chronic pain. So if you follow my mouse here on this bottom left-hand corner here, this is the PainTrace system. So the PainTrace system includes the disposable sensors that are applied directly to the skin. And then we have this white box here, and that's the device itself. And it's just about the size of a deck of cards. That transmits the data to the iPad, and then you'll be able to view the data on the application in real time. So you can see the data as you're collecting it. And then if you go up here to the top right corner, we can see the sensors are applied directly to the skin at the axilla area. So it's species specific. For the canines, the sensors are attached in the axilla just behind the elbow. And this allows you to measure pain all around the body. So just because the sensors are placed within the axilla, you can still pick up on pain everywhere. And then you can see up here in the top right corner, the PainTrace is being attached using the PainTrace wearable. And then just below that, we're starting our exam. And again, you can see the data in real time. So as soon as you start the trace, you can visualize the acute and the chronic pain. And then here at the bottom, we can see the veterinarian performing the orthopedic exam, and this is what you would be seeing on the PainTrace iPad. As you're performing your exam, you're actually able to pinpoint exactly where the pain is. So how does that actually work? How is PainTrace actually able to pick up on the acute and chronic pain? So PainTrace uses a proprietary neurosignaling technology, and this allows us to actually detect the ascending and descending pain pathways. And this then produces this really simple graph that you see at the bottom here. And I will go into a little bit more detail on this graph in a second. So don't worry if you can't read the really fine print here. But basically, the equilibrium between the ascending and descending signaling is what creates our baseline here. And the baseline is what represents our chronic pain state of the patient. It's almost like stepping on a scale. So as soon as the patient is hooked up to the device, you'll immediately be able to see the level of chronic pain. And that's based on where this baseline is settling relative to the y-axis. And then you can see the acute peaks here, and that's in the yellow and red here. The acute peaks are used to locate and identify or quantify acute pain. Those are in response to some kind of action. So, like flexing, extending, or palpating a joint. Those acute responses then elicit or cause these acute pain peaks. And essentially, the bigger the peak or the bigger the amplitude of the peak, the greater the acute pain. So, being able to pick up on this acute and chronic pain obviously allows you to use it as a tool in many different areas. I know a lot of people use this at annual wellness visits as sort of a screening tool, obviously because it's able to detect and quantify that acute pain. We know that pets are not so keen at telling us that they're in pain or where they're in pain. So being able to, first of all, immediately detect that whether or not they are chronically painful, but then also using it to pinpoint the painful areas with these acute responses, and then using that to guide your diagnostics. And then another really great use is being able to track pain over time. So being able to monitor recovery postoperatively, or if a patient is started on a medication, you want to track whether or not that's effective at reducing the pain. Then you can trace at the start of treatment and then later within the treatment to see if it's either reducing that acute pain or improving the chronic pain. And then obviously another great use is in rehab, which when I switch it back over to Dr. Tom, he'll have a lot to say about that. I'll go through this a little bit more in detail before we go into Dr. Tom's case. So again, PainTrace measures both acute and chronic pain, and we can actually differentiate between the two within the PainTrace graph. So the PainTrace baseline, this monitors chronic pain, and essentially the more negative that value is relative to this y-axis, the more chronically painful the patient is. So you could be at about a -1 and have some discomfort, or you could be at a -10, 20, 50, and you'd be considered chronically painful. And so an increasingly negative baseline is going to indicate a greater degree of chronic pain. And then the PainTrace peaks here, which we see in the middle, those are depicting acute pain. And again, those are in response to some kind of action like palpation, ambulation, joint flexion. Those represent the quantity of acute pain. And we've created this color coding system based on studies in humans that actually showed that the peak amplitude, so the size of this peak, correlates with human self-report. So that's where we have mild acute pain being color-coded yellow, moderate being orange, and then severe being red, and then anything greater than that is color-coded black. So essentially, you can visualize acute pain on the PainTrace graph when you're manipulating specific anatomical areas, and then that allows you to pinpoint the source of pain. And then you can also detect the presence or absence of chronic pain instantaneously by figuring out where this baseline is settling relative to that y-axis. So what does that actually mean for your clinic? Obviously, this is really valuable information, but how does it work in practice? So this is where I want to hand it off to Dr. Tom, and we're going to go through one of his cases with Gracie.
Thank you so much, Amber. Yes,
Thank
as
you.
a veterinarian that practiced general practice for about 10 years before I started my own rehabilitation therapy clinic, I know the kind of patients that come through your office, and this may be a familiar story for you. Gracie's a 11-year-old yellow lab golden retriever mix, and she was walking very well. Her averaging 2.5 miles every day with her owner. Mom noticed over a period of weeks that she was stopped being so energetic on her walks, and even turning around sometimes before they had reached their normal turnaround point. And she brought her to me after the referring DVM diagnosed her with osteoarthritis. And we got her stronger, more mobile, with a higher range of motion, all of the good things that rehab can do. And she was back to doing her 2.5 mile walks again. At the time, I did not have PainTrace with me as a tool. When I did get PainTrace, she was one of the first dogs that I wanted to try. This is one of her scans, and the reason I wanted to try it is because I wanted to see how much pain those hips were actually in. So I went through and did a orthopedic examination, and the good news was the hips were great. The bad news is you can see starting on the left, you can start with I go nose to tail with my orthopedic examination. So I was flexing the neck up and down. I was going left and right. We were extending the left shoulder and then the right shoulder. And then I flexed that left shoulder with no problem. But when I extended that left shoulder, that amplitude peak was in real time. So I was able to see it. In fact, Amber has cleaned this up for me because I actually repeated it, which is another wonderful factor with PainTrace. I extended that shoulder several times to try to make sure I wasn't hitting the device or causing an anomaly or pinching her in some way. And sure enough, this was a real finding, not an anomaly. So
Right.
what it did was it allowed me to take an animal that I knew for certain had pain in her hips, and we saw the progression of how we were able to get her healthy and moving again. But this was something I would have never seen. She was back doing 2.5 mile walks at this point with no limping, no turning around. This was something that she was accustomed to and had been dealing with for I don't know how long. So we were able to then adjust our treatment modalities and focus on that left shoulder and get her back to feeling well. And then her baseline went up back to a 0 or right above 0, which indicated no chronic pain. So
That's awesome. And knowing that she was, not visibly painful and, then being able to show this to the owner, I bet having something that's objective and tangible to show the owner is sort of helping that communication and
you're
opting for that
exactly right.
additional, yeah,
You're
opting for that
You're
additional
exactly
care.
right, Amber. The owner was thrilled to know that the hips
Hmm.
were great, and that's what we were measuring, but she couldn't believe it because this dog could get in and out of her car very easily, and she had a tall SUV, and she was like, "Are you kidding me? Every time she's getting out of the car, she's hitting this shoulder, and she's not even wincing, not even a problem." So we were able to really dial it in, and again, what's the most important question that every owner wants to know? Is my animal in pain? And we were able to
Yeah,
identify it without even the dog showing us any signs of it.
it's amazing. So now we'll go into a few more examples from you, Dr. Tom, on how else you're using it in your practice. Obviously, it's really great to be able to detect things that you otherwise wouldn't be able to see or even think to look at, but obviously you're using it in different ways as well. So I'll move on to your next case here.
Great. So, like I mentioned, I do nothing but only physical therapy and rehabilitation cases. So, I see a lot of common things that you guys see in your offices every day. And one of them being orthopedic cases. This is a post surgical. Bourbon is a yellow lab that had his left hind surgically repaired. This is a TPLO that had done, as you can see from that squat. And also when he turns, you can see how flared out those stifles are. The whole reason they are like that is because Bourbon tore both of them at roughly the same time. And over a short period of time, he learned that this is the way that he could walk. So this was a learned behavior to alleviate the pressure on his hips and his stifles. And so we are using PainTrace as we go through his recovery process, not only for the TPLO that has been surgically repaired on the left, but we know we're getting him stronger and feeling less pain. And then we'll be able to dial it in again on the right when he gets that operation as well. Back to our idea of not only seeing the pain that we can see, but also being able to track and monitor this along the
Mhm.
recovery process.
Exactly. And PainTrace is great for that with the ability to overlay traces. You can actually see the progression over time and see that reduction in acute pain, but also the improvement in the baseline over time.
Absolutely.
So we'll move on to the next case you have here
Yes.
with
Vieira.
Viera.
Vieira is a sweet mixed breed sheepdog type thing. She's a beautiful girl, and I think she's 13 years old. And as you can see on the left, that's a very stilted gait. She doesn't want to turn. She doesn't want to pivot. She wants to rotate her entire body. And she is doing her best just to get by with her chronic arthritis and also hip dysplasia that she has. So she is dealing with that through our many different modalities, including inflammation reduction and pain mitigation through laser and massage, ice therapy, etc., shockwave. We also are getting her stronger through, as you can see on the right hand side, with the underwater treadmill. So this is key in this type of case because I don't want to push Vera too far too fast. So I want her to be able to, since she's not going to tell me anything with her, the way she'll just plod along, and he has been for a long time. I want to know if we've pushed her a little bit too hard on whether it be the underwater treadmill or whatever. And that's the other thing about the PainTrace is the ability to do repeat scans over a short period of time. I can just tell my technicians to go ahead and run a scan after her appointment. We can see where she lines up on her pain scale, and then we can make adjustments out the door, telling the owner, hey, let's give her extra ice over the next couple of days. We really worked hard today and she's doing great, but we want to make sure that she's not feeling any repercussions. So geriatric
Yeah.
cases are really fantastic for PainTrace.
I think that's really great. Again, that communication tool, being able to show them this time after this appointment, she's in a little bit more pain. So now we'll try to pivot and change what we're doing afterwards so that she recovers well from it.
Absolutely. The other thing I just mentioned was my technicians being able to do this. The PainTrace is not going to hurt the animal, and it's relatively easy to do. And you can teach them to do a basic orthopedic exam or walk them around. It's wearable,
Mhm.
so they actually can wear it around, and we can have them go over steps or do whatever to mimic things that they experience at home. And it's real time. So the technician can see when there seems to be a fluctuation in those amplitudes, and they're able to say, hey, we saw this on the thing. Would you mind coming and checking this? So, in essence, PainTrace becomes very similar in your office to running a blood test. Technicians take care of it, they run it, you're able to analyze it and also communicate it to the owner.
That's awesome. That brings me to another question. The ease of implementing it into your practice and being able to create that really smooth workflow. How has that been for your practice? Because I know you're running a lot of traces there.
For sure. When you introduce anything new, there's always a little bit of trepidation, and that's to be expected. But Since this is also available to do on humans, I actually have the technicians train it on themselves so that they can see how to apply things, how to read, how to cut it on and off. And then you're not on the spot when an animal is being there fidgety and the whole deal. So we
Hmm.
use that as a door opening. And then we really pick some very chill dogs that are very easy to work with to ease them into it. But after a few scans, they're able to take the lead because they know they're not going to hurt the animal. And they
Right.
also feel very comfortable to be able to just move forward
Hmm.
with it. And they love the idea. In fact, we joke around that we've become pain detectives, that you were
It's fun.
trying to look for little signs of pain that the dog's not showing us or even unexpected areas.
Yeah, and the application is so simple and relatively it can be really quick to apply. So it really doesn't take a whole lot of time out of your day or the vet tech's day. And we're always here to help too with all of our training as well. So
You you bring up a good point
never
there,
alone.
Amber, is that when you start using PainTrace, the team at PainTrace has been fantastic to help us break down any sort of traces that we've done, any sort of anomalies, maybe some helpful hints on how to get a little bit more consistent. And that's always important in the beginning. A lot of times we come home from a conference or we buy a new toy or tool to use in our practice. And it's very difficult to integrate it in and also know that you're being able to do it right. I have my hats off to PainTrace because they've been there all along the way, coaching and helping develop this. So your customer service side is fantastic.
That's really great to hear. Thank you. So I guess we can move on to your last case here, neurological with gelato.
Yes. Gelato is a poster child for degenerative myopathy. Believe it or not, we are going on our fourth year with Gelato and a DM dog, and that's hard to believe. My neurologist friends are in constant disbelief. But the reason this is possible is through doing things on a regular basis that encourage his strength and mobility. On the left-hand side, he's working on an obstacle course there. And then also the repetitive motion of the underwater treadmill to where he's using it in a different way than Vieira was doing it. He's actually doing resistance hydrotherapy, just like walking at the beach with your water above your ankles. So we use gelato, we use neurological cases with PainTrace to do a couple of different things. One, you want to detect because, as we well know, there's a big difference between hitting your funny bone and smashing your finger in a car door. So there's different types of pain. And we want to see how strong those signals are in those animals and where we can concentrate our anti inflammatory modalities to try to reduce that as best we can. If there's no pain, well, there is with gelato, what we like to do is very much make sure that we design his activity level so that, again, he is not functioning by pushing too hard. You know, do we work too hard on the exercises and the floor exercises this time? Should we next time bump it up and do buoyancy hydrotherapy so that it takes the weight off his joints and he's still able to get the motion and the movement going? So you're really able to dial in your treatment protocols specifically to what that animal is feeling. And you can easily do this because a PainTrace, once you get used to it, it takes somewhere between 7 to 10 minutes that your technician is doing. So you can easily incorporate this into your daily work with your animal or your recheck, whether it be a post-surgical or whether it be a geriatric case that you're looking at, over a period of time, or something like a neurological case to where you're trying to keep an eye on where exactly his levels are. And we want to make sure that we're keeping him in a nice, safe zone.
So it's really interesting being able to see if there's pain associated with that movement or if it's just his neurological gait abnormalities and stuff like that. So that's really interesting.
Exactly.
Well, that leaves us into the question and answer session. So I don't know if you've gotten any questions on the Q&A. I know that One question that I had for you, Dr. Tom, that we've touched on quite a few times already, but what are some main, I guess, values and benefits that you've seen with using PainTrace in your practice?
Well, first of all, it's not about the money, but you know that we're running a business. So you want to take that investment value that you have in a tool, and just like a blood test, you can charge that just like a blood test. So that's an added bonus to your practice. But on the practicality side of it is the flexibility and the responsivity. So, in other words, you don't have to send anything off to get analyzed. You're able to do it real time. You're able to integrate it with your patients. And also, I think I mentioned taking the hands off of the doctor and really letting the technicians do it. And then you can go in and dial it in or do a little teaching. You can also, if your technicians have gotten you up to snuff and everything's great, you can also let them ride with it. So I really like the flexibility.
That's awesome. It's great to hear. But yeah, thank you so much. Thank you, everyone, for being here. Oh, we have a hand. Where are the sensors placed again, and does this impact where the pain is tracked? So I'll go back to this slide here. So the sensors are placed in the axilla for canines. So it is a species specific location, but for canines and felines, it's in the axilla. And this does not impact where the pain is tracked. So if they're placed here, it's picking up on the neurosignaling of the descending and ascending pain pathways. So it's picking up on pain anywhere in the body. So even if the sensors are there, you can be picking up on pain at the hips. And like Dr. Tom saw, he was able to pick up on pain when he extended the left shoulder. You're also able to pick up on any like cervical pain, spine pain, anywhere in the body, you can pick up on pain. But this is where we get the best signal to pick up on that ascending and descending signaling. And that's why they are placed there. So thank you for your question. Is there any other questions? So, is this primarily being used on rehab patients, or is it successful in other areas? It's definitely being used in many other areas. So, because you're able to pick up on acute and chronic pain, we can use it, like I said, at annual wellness visits as a screening tool to pick up on pain. We've seen it be used during surgeries to monitor the efficacy of anesthesia, as well as monitoring the recovery postoperatively. We've also, obviously, throughout rehab, but also just to monitor the efficacy of pain management in general, being able to guide your diagnostics. So, doing that full orthopedic exam and discovering what areas are exactly painful, and then using that to then guide your diagnostics. So, you can do targeted x rays or radiographs and so on. So it's being used in many different areas, also dentals, and monitoring the efficacy of dental blocks while you're going through that procedure. So lots of different ways, pretty much all areas of veterinary medicine.
Thank you so much, Amber. I really
Okay,
appreciate
well,
your time.
thank you. And I know you'll have to go, Dr. Tom. So thank you so much. And I hope you have a great day.
You too. Thank you.
Thank you so much to everyone who took the time to watch this, and I hope that you found it as insightful as we did. We're now going to transition into the live Q&A portion with Dr. Tom Walsh. If you have any questions about what you saw, how PainTrace works, or how it could fit into your practice, this is going to be the perfect time to ask. Before we jump in, I'd also like to quickly introduce Melissa and Ian. These are our exclusive distributor partners, and they'll be here to support any follow-up questions and help guide you through the next steps if you're interested in bringing PainTrace into your clinic. On the final slide, you'll find direct links to the PainTrace website, Apex Veterinary Equipment, and IWV Digital X-ray, where you can then follow up directly, connect with the team, and take the next steps to bringing PainTrace into your clinic. You'll also see contact information for Melissa and Ian, so you can reach out at any time. Thank you again for being here and for your commitment to improving how we understand and how we treat pain.